So some of the prenatal conditions, some maternal infections, we already talked about rubella, CMV. I'm not going to read them all. You can read those. Sometimes we don't think about that prenatal exposure to drugs or alcohol. Low APGAR scores. This would be, maybe kids who are born early or kids who end up needing to stay in the hospital for some reason. Prematurity, I'll just stop and mention quickly that the National Child Count gathers information and we categorize by etiology, by the cause of the deaf blindness. It's like the highest incidence come from complications of prematurity after unknown etiology. Okay, so it's like one of the main categories of deaf blindness now. So sometimes things happen before birth, sometimes things happen during birth, sometimes things happen after birth, okay? So some things that can happen after birth, I've worked with a little girl who had been in the hospital and born just fine and 5 days later developed spinal meningitis. You know who some of these children are, okay? So things happen after birth. That perinatal period, people define it differently, the perinatal period, but it's the time from birth till about 40 days afterwards. Some definitions go as long as 7 or 8 weeks after birth. So any of those things that happen just after birth are the perinatal things, and then the postnatal things that can happen later. We call these the red flag terms, okay? If you see this on a child's records, these are the things you want to say, we better think about the vision and hearing. Now, it doesn't necessarily mean that the child will have combined vision hearing loss, but again, it's a red flag. It means I need to get that checked out. Okay? So these are some of them. Basically, when you think about it, anytime there's a neurological disorder of some kind or neurological impact or neurological trauma, it's likely to affect vision and hearing. Not always the mechanics of it, but the processing. Maybe you've heard things like this, okay, from a parent or from one of your team members, well, sometimes I think he sees just fine, but then sometimes not so much, okay? She has this thing called charge syndrome, but the eye doctor said her vision's fine. I don't think we need to worry about anything. This little guy spent 2 months in the NICU. It says that he lost oxygen at birth. Here's a child with cortical visual impairment, maybe at shaken baby, or I lived in Las Vegas, and there were a lot of swimming pools in Las Vegas, and so I saw babies, a lot of near drowning babies. So, and sometimes people say, well, there's not a hearing problem. The doctors will say that. I don't know if any of you have ever been the one on the front lines who has to talk to the family about, well, yes, the ears work fine. There's nothing wrong structurally, but they're not processing. And sometimes the medical folks, the ophthalmologist and the audiologist will say, well, everything's fine. The ears are fine. They work fine. Okay. Some of the things to look for in appearance, okay, abnormal structures, abnormal shape or structure. Those kids who have been to a craniofacial clinic, okay, when there's stuff going on with their face. The kids that hold their head funny, or look funny, or are always looking up, just not doing things that you would expect. Those are the behaviors. How they hold their heads. And those very early skills, tracking, okay, reaching for things, or responding to your voice. It seems pretty obvious, okay? So I just say remember your ABCs. Look at the appearance, the child's appearance, okay, their behaviors, and the conditions, okay? And when you're somebody who, birth to 3 folks have usually more access to, or more likely to have access to those birth records and the early health history. By the time people get to school, sometimes they don't pay much attention to that stuff, but you guys have access to those, so really look at those. I like I like to get to know a kid as a kid first. Okay, you want to get to know the baby as a person first, but it's really important then, after you get a sense of who that baby is, to really dig into those records, see if any of those terms appear, see how long that baby was in the hospital, see what if there was anything going on in the mother's history, and just really look at that. Find out if it was something that the baby was born with, if it was congenital, or if it was something that was acquired because of an accident or some trauma.